Hi, Assalamualaikum everyone. You might already heard about gynaecology already, right? So today, me and my friends Sophia, Swaila and Ikriani will talk about non-gynaecology. At the end of this video, hopefully you guys will be able to define non-gynaecology, can briefly explain the type of specimen, procedure of collecting specimen, preparing smear, staining and microscopic examination of non-gynaecology, and able to explain the normal and abnormal finding of non-gynaecology. Cytology is the study of individual cells, while cytopathology is the study of individual cells in disease. Non-gynaecology or diagnostic cytopathology is the diagnosis of disease at the cellular level from cells that come from any location except the cervix. It involves the collection, filtration, staining, and microscopic examination of cells that has been extracted from the body, mostly in the fluid form.
Hello, my name is Nur Sophia Aisha. So, how many types of non-gynecological specimens? There are 4 types here, which is number 1 is mucus-rich samples, number 2 high protein fluids, number 3 washings, and number 4 is protein pure fluids. So, all 4 types have 2 examples stated here. As we can see, for mucus-rich sample, the examples are sputum and bronchial aspirate. For high protein fluid, the examples are pleural effusions and peritoneal effusions. For washings, are bronchial washings and gastric washings. For protein pure fluids, they are urine and cerebrospinal fluid. Okay, after we know all 4 types of non-gynecological specimens, let's proceed to how the specimen is collected in more detail. Okay, for sputum is directly taken from conscious patient. So the point here is conscious. And after the sputum is collected, his or her will put in a clean container. So the clean container look like this. Okay, this is a clean container for sputum. Same as bronchial aspirates. The sputum is also put in a clean container, and the point is also directly taken from conscious patient. Then high protein fluids, which is type 2, they are pleural effusions. Pleural effusions is taken from the cavity between the ribs and the lung by using needle shrink or catheter, and also put in a clean sterile container. As for peritoneal effusion, the patient need to empty their bladder, then a needle is inserted through the skin at their abdomen and a fluid sample is pulled out. After pull out the fluid sample, the fluid is collected into a tube which is syringe that attached to the end of the needle. Next, for bronchial or gastric washings, first step is centrifuge the samples. So as we can see here, they are a bit different from other types, which we need to centrifuge the samples first, because we only need the sediment. So after we centrifuge, we will remove the supernatant. So the tube look like this after centrifugation. So this is the sediment, and the upper part is the supernatant. So we discard the supernatant and we only need the sediment. If the sediment is very mucoid, smears may be prepared as described for sputums and bronchial aspirates. But if the sediment contains only a small amount of mucus, prepared by two-slide method described for high protein fluids. If the sediment has no visible mucus, it should be prepared as described for urine sediment. Next is protein for fluids. They are urine and cerebrospinal fluid. Urine is taken by needle and syringe or catheter, and the specimen is, of course, we will put in a sterile container. As for cerebrospinal fluid, the fluid is taken from the cerebrospinal cavity by using needle, syringe or catheter and put in a clean sterile container. Okay, before we view under microscope, what we need to do is slide staining preparation. So step 1 for slide staining preparation is smearing. In this slide, there are the procedure that show step by step how we prepare two-slide pull method. So started with first step, transfer 5 ml of peritoneal fluid sample into the falcon tube. In this procedure, it used peritoneal fluid as sample of non-gynecological specimens. Then after transfer 5 ml of peritoneal fluid, we spin the sample into centrifuge at 3000 rpm for 5 minutes. After centrifugation, discard the supernatant and leave about 2 ml of the sediment. We only need the sediment, that's why we discard the supernatant. After that, mix the sample gently, which is the sediment. Then place only a drop of sample on the slide and make a smear of 2 slide pull. After that, air dry. This is the arrangement of pap staining. Start with 95% ethanol, 70% ethanol, distilled water, 70% ethanol, distilled water, Harris hematazilin, 1% hydrochloric in 70% ethanol, 70% ethanol, 3% ammonium hydroxide in 70% ethanol, or we can use Scott's water. Then proceed with 70% ethanol, 95% ethanol, orange G6 which is OG, then 95% ethanol, eosin Asia 65. Okay, as we know, EA65 is for non-gynecological samples. After that, dip in 1% ethanol and lastly dip in xylene. That is the arrangement of pap staining. After that is microscopic examination. Okay, microscopic examination has 3 main steps, which is first is rapid view, second is screening or smear, and third is preliminary assessment. Okay, rapid review is a review of the smear with 10 time objective lens. Okay, the point is with 10 time objective lens. With this objective, it will provide information on the makeup of the sample and its cell content. Okay, that is the first step of microscopic examination. Proceed with second step, which is screening of smear. This step is a careful review with also 10 time objective that identify abnormal cells that may be few in number. Then preliminary assessment is the screening of smear should lead to the preliminary assessment of the sample.
Assalamualaikum. Hi, I'm Suhaila Zulkifli. So in my part of this video presentation, I will be presenting to you the normal findings of non-gynae specimens. So first and foremost, I would like to explain my part. It will be pretty straightforward because I will first briefly explain to you the purpose of the cytology, and then I will show you the slide and explain what we are seeing in the slide. So firstly is the cerebrospinal fluid cytology. CSF non-gynae cytology report is based on cellular morphology, leading to an assessment of malignant potential. A non-gynae cytology investigation of CSF may be of use in patients with the following clinical presentations, like meningitis. The samples were gathered using the lumbar puncture procedure. So this is the slide. Normal CSF cytology will show minimum presence of lymphocytes and monocytes because, as we all know, CSF is a sterile fluid, so there will be 0 to a minimum presence of cells, white blood cells, epithelial cells, and whatnot. The next is sputum cytology. A sputum cytology test is done to determine if the patient has the following possible conditions. First is lung cancer, and asthma, tuberculosis, and lastly pneumonia. So in these slides, the image shows mature superficial squamous epithelial cells, white blood cells, and cell debris. So this shows mature superficial squamous epithelial cells because of the color in the cytoplasm of the cells. Because as we all know, as the squamous epithelial cells mature, they will produce more keratin in the cytoplasm, which can pick up the pink or orange dye which we see in the slide. The next is bronchial alveolar lavage cytology. Bronchial alveolar lavage cytology is commonly used to diagnose infections in people with immune system problems, pneumonia, in people on ventilators, and acute respiratory distress syndromes. So in this slide, there is a cluster of ciliated columnar epithelial cells with an interspersed globule cells, the black arrow, containing purple globules of mucin in the cytoplasm. There are also low numbers of neutrophils and eosinophils, the black arrowhead, along with free cilia in the background, which indicate by the red arrowhead. So ciliated columnar epithelial cells, globule cells, they are commonly found in our respiratory tract, which is commonly found also in BAL cytology. And there are also low numbers of neutrophils and eosinophils. The next one is peritoneal fluid cytology. Peritoneal fluid analysis is used to help diagnose the cause of fluid buildup in the abdomen, as known as ascites, and the cause of inflammation of the peritoneum, also known as peritonitis. So in the slide here, macrophages can demonstrate leukophagia. There are also small lymphocyte and apoptotic cell, which according to the resource, it is likely a neutrophil, indicated by the red arrow. So I would like to explain that this slide, for peritoneal fluid, it is also known as sterile fluid, such as like CSF. So there should be a minimum to zero amount of white blood cells or any cells in the fluid itself. So peritoneal fluid will be normal if the slide shown is very similar to CSF, if you can understand me, I hope. So that is it for normal findings. If there are any questions you would like to ask about the normal findings of non-gynae specimens, you can contact me or my group to find out more. So that is it from me, and we'll move on to abnormal findings. Thank you.
Okay, so let's move to the abnormal findings of non-gynecological specimens. The first one is salivary duct carcinoma. Salivary duct carcinoma, SDC, is a rare primary salivary gland malignancy in high and low grade. High-grade SDC is the most common subtype, which is more than 90% of cases and considered one of the most aggressive salivary gland malignancies. It has moderate to severe nuclear atypia and pleomorphism. Presence of associated necrosis in the background constitutes an important clue to the diagnosis of high-grade SDC. In low-grade SDC, the neoplastic cells have a uniform appearance and show minimal atypia. So this is the examples of high-grade salivary duct carcinoma. There are flat sheets of epithelial cells with abundant delicate cytoplasm and moderate nuclear atypia. The nuclei are round to oval in shape and show finely granular chromatin and prominent nucleoli. Abundant necrosis is associated with the malignant cell. Next is actinic cell carcinoma. Actinic cell carcinoma is malignant epithelial neoplasms of the duct apparatus, but occasional lesions seem to show acinar differentiation. The cytology is low-grade malignancy characterized by sheets of large cells with abundant cytoplasm. The neoplastic cells have vacuolated cytoplasm with ill-defined borders, eccentrically placed nuclei, small inconspicuous nucleoli, and lack significant nuclear atypia or pleomorphism. It has occasionally lymphocyte and psammoma bodies, and the background is clean. So this is the examples of actinic cell carcinoma. The first picture shows irregular clusters and sheets of epithelial cells with foamy or granular cytoplasm and bland nuclei. The second picture, which is the middle one, shows red granules within their cytoplasm. And the last one shows a finely vacuolated or foamy cytoplasm. Next is sputum cytology. For inflammatory lesions, it has acute inflammatory lesions and also chronic inflammatory lesions. For acute inflammatory lesions, Papalicolos stain smears are predominantly cyanophilic. Plenty of damage, an intact polymorphonuclear leukocyte, and necrotic material forming threads and amorphous masses. For chronic inflammatory lesions, we can see good number of neutrophils, alveolar macrophages, few lymphocytes, monocyte, occasional neutrophil and goblet cells, and also spherical or ovoid papillary cell clusters, which is creola bodies of benign bronchial cells, then binucleated or trinucleated giant cell macrophages. And if it is suggestive of tuberculosis, it has epithelial
epithelial cells, Langhans types of giant cell, necrosis, and predominant lymphocyte. This PET stain of sputum showing Langhans types of giant cell with peripherally placed nuclei. If the sputum is positive for malignancy, it has squamous cell carcinoma, which is well-differentiated characterizing squamous cell carcinoma, and poorly differentiated squamous cell carcinoma, or adenocarcinoma, which is acinoadenocarcinoma or bronchoalveolar carcinoma, and large cell undifferentiated carcinoma or small cell undifferentiated carcinoma. This is the PET stain showing cells of adenocarcinoma, and this one is PET stain sputum showing squamous cell carcinoma. The next one is bronchial washing cytology of pulmonary Langerhans cells histiocytosis. The pictures show that the cells have abundant pale granular cytoplasm with a convoluted irregular nucleus and fine chromatin pattern. A is cell block, B is thin prep, C is conventional smear, and D is immunohistochemical staining for CD1A is positive in the Langerhans cell. So this is the histologic features of a large cell neuroendocrine carcinoma. The first picture shows the tumor cells are arranged in organoid nests accompanied by central necrosis in the arrow and show peripheral palisading. And the B pictures shows rosette formation is apparent. For these pictures, let's see one by one. A. We must note that necrotic debris in the background. The tumor cells are connected loosely and the cluster does not show any characteristic arrangement. B. Looking at the arrowhead, it is tumor cells are more than 3 times larger than mature lymphocytes and have abundant cytoplasm. And the arrow shows that the presence of naked nuclei. And C, the chromatin patterns of tumor cells is fine and granular and nucleoli are prominent. And D, if we are looking at the arrows, it shows tumor cells often show nuclear infolding. And for these pictures, the first picture shows nuclear streaking is recognized in a large cell neuroendocrine carcinoma. And the second picture is rosette arrangement. The tumor cells are arranged in a radial pattern. So this is rheumatoid pleuritis. It shows an elongated multinucleated histocyte in a background of amorphous granular material. So this is another examples of rheumatoid pleuritis. We can see that the field is dominated by amorphous granular material in which there is a solitary giant multinucleated histiocyte.
In conclusion, a variety of human diseases can be diagnosed with diagnostic cytopathology, including infection, crystallization, diseases, and benign tumor. But the primary aim of this procedure is the diagnosis of cancer and pre-cancer without the need for surgery. That's all from us. Thank you for watching.